Good morning, everybody. It is Angie's podcast, The Long Term. That tells you it's the last Tuesday of the month. And I think I cannot make myself think that July is the first month of the third quarter. It is hard to believe that we've already gone through this. And here in Kansas, summer is about ready to end, only because the kids go back to school here in the next couple of weeks. And so that kind of marks the end of summer, if you will, which means buses will get started, parents will go back to work, probably with a little bit of relief that they can actually devote more attention to work than maybe the summer vacations. But hopefully everybody had a wonderful summer. I know it's starting to really, really warm up this week. We're to be in triple digits the whole week. So it's going to be a typical summer week here in Kansas. This month, I actually had a guest that I wanted to bring on and speak about an article that actually hit our local news. And I called and he was like, yeah, that's great. And I said, it's just really informal. And he said, who's your audience? And I said, a bunch of wonderful, brilliant-minded insurance professionals that have a passion for long-term care insurance and extended care planning. And I don't know if I scared him. And he committed and said, yeah, that sounds great. I said, it's really nothing more than me just kind of talking about the article that you wrote, because I think it would be very interesting and intriguing to them. And sent him the link and said, here, you can register. And then I got an email back and said, Angie, we don't feel that maybe we should be on the podcast, which is fine. I completely respect that. But I said, nonetheless, I'm still going to talk about your article because I do think it's well worth the time. And what I found intriguing was I actually didn't spot this article. Gentleman Scott Gilpin here in our office actually spotted it on our local news link, the Salina Post. And the title of the article said 1/4 of Kansas nursing homes labeled problem facilities because of persistently poor care. Now, you may be saying to yourself, Angie, that's really nothing new. That's not new news. Not to take the fun away from the Kelsey brothers and their podcast, but no, it's not new information coming out about nursing homes and having poor care and things of that nature. But I found it intriguing. Every time something, I feel like, as things kind of, I said this about COVID as well, right? It just takes a while for things to ooze its way into the middle of the country. And so when things like this actually make the news here in our area, it definitely tells me that if it's touching small town America, it's definitely touching big town America. And I wanted to just highlight a couple of things out of here because it was interesting to me that the result of what CMS thought they could do to maybe help this situation. And so a little bit about this was a national coalition reported that about 1/4 of Kansas's 300 nursing homes were categorized as problem facilities, with persistent compliance issues and substandard care issues. And there's a 5-star rating that is assessed to these nursing homes, right? And it showed 24.6% of these nursing facilities in the United States were problem facilities after receiving just a 1-star rating. Now, knowing that you shouldn't just use a star rating, and quite frankly, I don't think when families go into a crisis of knowing that a family member, a loved one, is going to need care, I don't know that they're sitting in the nursing home Googling the star ratings of these facilities. They're just trying to keep their head above water. In Kansas, it said that 25% of these nursing homes had that lowly score based on some inspection reports, a lot of it coming from staffing levels. Well, no surprise there as well, right? Staffing in nursing homes, there's usually a lot of turnover in there. And I have to tell you, I have a niece that just got her LPN degree. Shout out to you, Miss Emily. Good job. She loves working in nursing homes. And that's where she wants to take her career path in. And she's been working for one. She's actually in the state of New York, and she's been working for one. and wants to continue her career there. And she draws such a connection. I don't know that you see that with a lot of folks, because it takes an awful lot of patience and empathy and consideration when you're dealing with folks inside of facilities. So it takes a different set of eyes to look at folks that are in these institutions and bring that care from your heart to them. In Kansas, 6 out of 10 nursing homes were owned by for-profit companies. 3/4 of the state's troubled nursing homes were of for-profit variety. And it says here, if we're outperforming the nation, that's pretty bleak. And I would agree with that. If we've got such staffing and poor quality of care coming from that many of our facilities here in Kansas alone. Now, keep in mind, this is a nationwide problem. There's some things that need to be addressed, right? Well, how do you start with that? Well, there was a federal staffing mandate in April. The Centers for Medicare and Medicaid, right, also known as CMS, that's what we call them, published a rule that said that they're going to reform long-term care nursing facilities that serve 1.2 million residents. 1.2 million residents nationwide are in care. And they're going to fix this because the agency, CMS, ordered that they would increase the required staff to resident ratio, mandate a registered nurse be on site 24 hours a day, and expand regulations related to assessments of these facilities. All that sounds fantastic, right? We're going to try to bring out some better care, but this is concerning when you start talking about metropolitan areas versus rural areas. And so this new rule was to be implemented over a 3-year period, prioritizing safety and health of the patients inside of these facilities. And in 2026, so that's when they're going to start working on the urban facilities, and 2027 for the rural facilities. Well, rural facilities is very, very impactful in Kansas, and probably impactful with a lot of places around this country. Of course, one of our senators and congressmen said, we don't think this is good. Overly burdensome rules, devastating. It's going to further increase operating costs. It's going to exacerbate the problem, especially here in Kansas with those urban facilities. And so, of course, they're opposing it. And so now you get into this whole political football game again, right? Well, we got to looking at inside the numbers of this, and I wanted to let you know that there is, and I'm sure in every state there's something like this, but we have an organization called Kansas Advocates for Better Care. I am like embarrassed to say I did not even know. I didn't know what this was. So of course you get on the Google and you start looking them up and everything. Fascinating the work that they do. And I know that there are organizations like this all over the country that do this very same thing. But this organization, this association here in Kansas, indicated that 77 of the 306 nursing homes in Kansas were problem facilities. So the analysis indicated that 1/3 of the for-profit facilities had low scores, or in other words, 58 of the 183 for-profit homes were rated as problematic. What else I thought was really intriguing here was the gentleman that actually is kind of the spokesman for this. His name is Dan Goodman, the executive director of Kansas Advocates for Better Care here in Kansas. He was the one that was interviewed for this article. He said that there's investment companies that are now getting into this nursing home industry. Now, when I pause for a moment and think about this, and I think about, wow, that private equity, but they've got some money to spend, don't they? Is it because there's 10,000 people a day turning 65 and they've been doing that now for over 10 years? Is it because they realize that there's poor planning out there for extended care needs? Is it because we know we live longer before we leave this earth? Whatever the reasons are, right? If they see this as an opportunity, why in the world would we not be beating our drum about extended care planning? Because there's definitely a need for that. What's the one way that you can help your family members or your loved ones or your clients or your community or the people that you work with, your property and casualty clients. How do you help them? You have this discussion. If their plan is to not buy insurance, that's fine, but go through a planning worksheet. If you're going to do that, what are you earmarking to pay for your care? Help them put a plan in place. That's really all it is. Insurance is nothing more than a funding mechanism for the plan. You still have to have a plan. People don't just have birthday parties. They don't just have retirement parties. They don't have funerals. Someone's planning this. Why wouldn't you plan for your care? You do it now, unless you're walking around with no health insurance. You have a plan for your care. Well, what's your plan for care when it becomes extended? And keep in mind, right, extended only means you're unable to perform 2 out of 6 ADLs or have a severe cognitive impairment, and that expectation need of care is 90 days, 3 months. 3 months, you can't feed, dress yourself, you can't bathe, toilet yourself, you can't transfer. That's a long time. So investment companies, including real estate firms, were buying into the nursing home industry. Operators of those companies don't have a background in healthcare delivery system. So how are they going to grasp the concept of providing this compassionate care needed at that level? And this comment that Dan Goodman said, I mean, anybody with a heart, this is going to just break your heart. Individuals are suffering and probably dying sooner than they should be. And that is heart-wrenching. So to think about the industry that we all love, and all of you that join me every single month, or you listen to me on demand through this podcast, I think, I mean, month after month, what have I been doing this? A couple of years now? Month after month, we talk about the need for it. And I know you all believe in the need for it. And believe you me, I know it's getting harder and harder to sell this. So you have to get creative in the ways that you are comfortable bringing this conversation up, because this article just drives back to the exact reason why people don't plan, because they'd rather bury their head in the sand than have an honest conversation with themselves, let alone with their advisor, to say, what happens if? More importantly, what happens when? Not if, when. Because we all get sick along the way. Not many of us just get to ascend, right? Not many of us just leave this earth in a poof. Most of us get sick along the way. What are we going to do when that sickness becomes too much? Because all of you know, right? Medicare's not paying for a chronically ill individual. Okay, yeah, maybe a few days, but definitely not more than 100. And the average stay that Medicare picks up the tab, 25, because usually within 25 days, you're either better and you go home, or you're going to stay where you're at. But the hospital's not keeping you. So I just thought that this article was very pressing. I look forward to all of you tuning in next month, where I'll come up with another fun conversation around talking about extended care. And hopefully you all find this insightful and interesting. And those of you in Kansas, go make a difference, right? In any state that you live in, go make a difference. Go help your clients plan for extended care, whatever that plan looks like. If it includes insurance, great. If it doesn't, at least they have a plan. Thank you all very much for joining. Have a great day.